Good afternoon and welcome to the COVID-19 Precautions and Safety Measures presentation. My name is James Garrett Jr. and I am the Executive Director for the Indiana Commission on the Social Status of Black Males. Today, we are honored to have Dr. Lindsay Weaver, Chief Medical Officer for the Indiana State Department of Health, as our presenter. Dr. Weaver joined the State Department of Health as Chief Medical Officer on February 3rd, 2020. She brings to the role a passion for both emergency medicine and end-of-life care. Dr. Weaver is an assistant professor of clinical emergency medicine at the Indiana University School of Medicine and practices emergency medicine at Methodist Hospital in Indianapolis. She's board certified in both emergency medicine and hospice and palliative care medicine. She has served as quality director for the Department of Emergency Medicine and physician lead for the System Sepsis Steering Committee at IU Health. She also served as executive director for the Indiana Patient Preference Coalition and as president of the Indiana chapter of the American College of Emergency Medicine Physicians. At the conclusion of Dr. Weaver's presentation, we will have a question and answer session. I ask you to use the chat function to share your questions for Dr. Weaver. And with that, welcome Dr. Lindsay Weaver.
Hello, everybody. Thank you so much for having me here today. I really appreciate the opportunity to talk to all of you about some quick updates, the Back on Track plan, and how basically to keep yourself safe, your community safe, your customers safe, and what some of those things look like. And then some of the things that I worry about as a health officer here in the state that, you know, it is my job, not only as a physician, but as someone, you know, who lives and works and plays here in Indiana, the things that I want, you know, my friends and family to know, some of the things that we worry about at the state level based on the information that we know about COVID-19. So as mentioned, I'm the Chief Medical Officer, brand new. I had no idea when I took this job in December that there would be the 100-year pandemic. I've had the wonderful opportunity through this process, though, to meet so many passionate people, and so I've really appreciated the opportunity to serve. This is our new updates for today. So new positive cases, 440 in Indiana, and 14 new deaths. 8,000 tests were done yesterday, and you can see the totals there. So we've had 2,265 people die here in Indiana. We are encouraged that the death numbers continue to go down with each day. Depending on where you live in Indiana, the numbers of the positivity rate also is going down. I will say, with the exception of a few hotspots. For example, I am actually in Elkhart County right now because they are having a surge of cases. So I think the important thing is that if you are one of those people like myself who looks at the dashboard every day and you're encouraged by those numbers going down, just to know that that doesn't mean that we couldn't have another spike in cases like we're seeing here in this county and a couple other places here in Indiana. So we need to make sure that we continue to practice all safety measures. I also wanted to remind everyone, if you didn't know, that we have testing sites up on our website. So if you go to coronavirus.in.gov, at the very top, there's a button that says COVID testing. Click on that button and it'll bring you to this map. And this is an interactive map, so you can go to your county there on the right and click that county. And if you, it'll show, like, zoom it in so you can see the testing sites there. And then I recommend hovering over the testing site and it'll give you all the details, what days it's open, what hours it's open, and who is able to get that testing done there. So the sites that are run by the state, for example, the Optum sites, anybody can get tested. There is no restrictions whatsoever. So if you feel inclined to go get tested for whatever reason, you are more than free to go there. We only ask that you have a picture ID that proves you are who you are. It can be a work ID, it can be a driver's license, whatever it is, just so we can make sure that we can identify, make sure it's the right person. And we're even seeing children at those sites. Now, the other sites, whether it be Kroger or Walmart or a hospital or et cetera, they are able to choose, kind of who they are wanting to test there, whether they want to make sure that you're symptomatic or a healthcare worker or an essential worker. So just make sure that you look for those details on those sites so you know exactly before you go and before you sign up. As you know, we are, or probably know, we are now in stage 4 of the Back on Track plan. So back in April, when we started talking, what does reopening the economy look like in Indiana? We really wanted to project out and be optimistic about where we would be. And the reason we wanted to do that, we didn't want there to be any surprises for people and, just one day we'll say, okay, tomorrow this and this and this will open. We really wanted to be optimistic and say, okay, as long as everything keeps on going well, where do we see ourselves in a couple weeks, in a month, 6 weeks, 2 months, just so people can plan. And I feel like that really helps people just to better get their head around instead of being like, how long am I going to be stuck in this situation, that they can really kind of move forward. So all this information is on the Back on Track website. If you go Back on Track Indiana, that you'll be able to find it, and it goes into some pretty good detail. Still, we know that people who are older than 65 with multiple medical problems, diabetes, hypertension, cancer, immunocompromised in some way, and I'm sure I'm leaving some out, are at the greatest risk of having serious illness. If you go on our website and you look at the ages of people who are likely to die from COVID, you'll see that it is predominantly people in their 70s and 80s, and that number goes down significantly as you get younger and younger and younger. So we need to continue to protect our vulnerable people here in Indiana, and just be conscious as people start to move around to make sure that, again, I know you've all heard this 1,000 times, the reason you wear your mask out and about, the reason that you wear your mask in your place of business is really to protect those other people, those people who are the most vulnerable at getting sick. So again, on here it just says, face coverings are recommended. And you're allowed to have social gatherings of up to 250 people. At the end of my presentation, I will share some information with you that we've discussed with the CDC and in reading reports, that we really do feel that those big gatherings are where people at most at risk. So while those gatherings are permitted, it is so important that people continue to do the social distancing practices while they're in those gatherings, because we have found and we have witnessed, even here in Indiana, of some gatherings that we've known about where several people have gotten sick and even some people have died. So we just want to share with you what we know so you can be best informed and make those decisions for yourself. And as you know, dining room service has opened up to 75% capacity, bar seating in restaurants opened at 50% capacity, bars and nightclubs 50% capacity, and then movie theaters and other culture and entertainment has opened up as well. I will say that with each step, while this has kind of been the recommendation, some business entities have chosen not to move on to that stage because they felt like they couldn't keep their customers or their employees safe or whatever, for whatever reason. So we support people, wherever they're at in the process. And just some more information. I won't go through all this with you. I just want you to know kind of the information's out there because it's helpful. Right now, we're getting lots of questions about back to school and about sports as well. So to the best ability that we can, there's details on the website if you have specific questions about that as well. For personal services, so appointments are preferred. Workstation space to meet social distancing guidelines, which again is that 6 feet of social distancing. Use tools to screen employees daily. So I've had people ask me, is that temperature checks? It can be. It could also be just a process of, are you having any symptoms? Even before you leave work in the morning, do I have any symptoms? Have I been in contact with anybody that has COVID? And if no, then fine, proceed to work. But if yes, then you really need to stay home. and then go seek to get testing. I will say when I log into my computer every day at work, it asks me a series of questions: cough, loss of taste or smell, fever, shortness of breath, and then I have to click OK to kind of move into my computer. So every place is different in how they're approaching that, but I think it's important that everybody kind of has a check-in daily. I think that we're all used to kind of working, feeling a little bit unwell, sniffles or whatever, and we're just not in a space where that can happen these days. Employees must wear face coverings. Customers must wear face coverings to the extent possible. Some people are unable to wear face coverings for whatever reason, but again, I'll share later in my commentary that we're getting more and more evidence that face coverings, even the cloth face covering masks, do help prevent the spread of disease in a community. And then we also ask that you share your COVID-19 safety plan. And of course, personal services are open for full service at this, in July 4th is what we're projecting for stage 5. And that's, again, if everything goes okay. We're monitoring our numbers very closely. We worry about some of the large gatherings, whether it be from Memorial Day weekend and the protests. Will we see a spike in cases after those gatherings of people? Because like I shared with you, large gatherings does increase your risk for spread. Thankfully, those are outdoors, and we believe the spread is significantly lower for people that are outdoors. So hopefully we don't see any spike, but we are watching the numbers very, very closely. People ask me all the time, do you think July 4th is really the day? I will tell you that we watch this on a day-to-day basis, and honestly, a lot of the decisions are made at the last hour because we want all the information that we could possibly have before any, policy decisions are made or any kind of recommendations. From my standpoint, I'm just a doctor. I give my recommendations, kind of leave the policy to the policymakers. But I've been very, impressed, like how much that local and state officials really are welcoming the voice of the medical professionals here in Indiana. So a little bit more information. 6 feet between employees if you're using stations, and if not possible, install barriers. I'm sure people have seen those plexiglass things, at grocery stores, etc. We really do believe that works. The point is to just protect people from, if you were to cough or sneeze, from that droplet transmission. But if you're wearing a mask, that also helps with that. People ask me too, like, why 6 feet? Where did that come from? When people cough and sneeze, it's with enough force that we actually believe it probably goes out to 4.5 feet, and that extra amount of space is really just to give that extra barrier. Additionally, shouting, singing, those kind of things that are projection can also make make the germs, make the sputum go far, and that is how you catch a disease. If someone is coughing and then you would inhale, that's how you get the virus into you. I think that the reasons for appointments really is just to control people from gathering, right? So if you are typically work as walk-in only, the worry is that 20 people show up and then all those 20 people are mingling, waiting their turn, and then potentially sharing the virus. I think that could be mitigated and definitely should continue to be mitigated down the road. If it's a nice day, I've seen where chairs are spaced out outside so people can, appropriately space themselves out outside and wait. I've had instances where they said, give me your text or your phone number and I will text you when I'm open. Go sit in your car or, drive around the block or, walk up to the store up the street or whatever it may be. But that's the worry and why the recommendation for the appointment only, just so you don't have a big influx of people and people all around sharing germs. Because like I said, and we'll say several more times probably, those are the times that we really worry the most about the virus being spread. And again, training people on the importance of hand hygiene and sanitation. I think we all have really bad habits. It's hard for me not to, touch my face, pull my hair back, etc. So, just very cognizant of using hand sanitizer if you, touch anything that could be, dirty or have the virus on it, especially before you eat, or could potentially expose somebody else. I already talked about screening people and really encouraging people who are symptomatic to stay home. I think, even me in the medical field, is kind of a badge of honor to work not feeling well. I remember during the flu in 2009, I was still a training resident. And honestly, the expectation was that I work, even though I had the flu. And we can't do that anymore. I mean, those old days have to go. And I think whatever we can do as employers to help support our employees and let them know, like, hey, if you're sick, you need to stay home. I know there's some worry about people taking advantage of those situations, and I'm sure that there are some people who would do that. But I think for the most part that we just have to trust people that if they're staying home, they're trying to protect them from me and from my customers and from everybody else. Requiring face coverings of employees, I honestly think that data speaks louder than words. Like I said, I'll be sharing some information in a little bit about what they feel like face coverings really has done in some places in the world where they were actually mandated. I will also share with you at IU Health, which is where's my work as an emergency physician still on top of my state job, that we did a study and they tested a bunch of healthcare employees, some that were working in the really hot COVID zones and some that were, weren't even seeing COVID patients. And the percentage of people that were positive for the antibodies was exactly the same. And so what that tells us is that the face masks that we're wearing and taking proper hand hygiene and making sure that we're spacing out from each other really, really does work. So I just want to tell people that, I think a lot of people kind of shrug their shoulders, but it's important that we share that kind of those measures do work. And of course, cleaning surfaces is always important. Even though we don't feel that the virus, that's not its main transmission of spread, it's still possible. If someone literally coughs in their hand, grabs a doorknob, I grab the doorknob, and then, I don't know, put a donut in my mouth, that I could possibly, inhale it at that point. I think it's important to remind people to social distance. I always really appreciate the X's on the floor for me to kind of remind me, okay, stand here, sit here. If things are already spaced out, people are more likely to follow those recommendations than to kind of do it on their own. It really takes everybody, I think, reminding each other. And making it okay, having hand sanitizers available for people to use, and washing your hands if you're in a high contact location. And then, unfortunately, the more people you have in a space, the more exposure you have. So limiting people, so that you can maintain that social distancing, even if it's, not having a guest accompany a customer, is definitely appropriate. Something else I think that the grocery store started doing, and I also really appreciate this way to support the vulnerable populations, is to have a specific time for people who are more at risk, where there's less people there, and any additional precautions that need to be taken can be done. And if you can offer that to people, I think people really, really appreciate that, and it's just a good thing to do. Remove anything that's high touching, magazines, newspapers, something that people can, or just would touch as much as possible. And then, taking the time to wipe down seats or tables with disinfectant, just your over-the-counter, disinfectant that they'll say on there that it fights the coronavirus. There's also a recipe on the CDC website to tell you how to, what part bleach, what part water to use as a disinfectant. If that works better to fill up your own spray bottle and use that. I think a lot of people have been using that, and that's totally fine. And then just, anything that you can do to decrease a lot of people touching the same surface. If you have something where you have to, where someone has to touch a credit card thing or something, just have hand sanitizer there available for customers to use. Just more information about cleaning things off. And identifying those high workspaces and making it part of your plan, that after each customer, clean the workstation, clean tools, how are you going to sanitize your equipment, etc. And I'm sure these are all things that everybody is already doing and thinking about. And again, all the stuff is on the Back on Track website. Several industries submitted to us their work plans, which we appreciated. We're not approving them or disproving them, but we are reviewing them and we are putting them up on the website for people to refer to. Like I said, use any of the disinfectants that are for viruses. They'll say coronavirus on there, even though they're not specific to COVID-19. It does work for COVID-19, and then the bleach that I spoke about as well. Gloves are an interesting and a little bit controversial subject. So I think gloves are appropriate if you use them appropriately. I think that was something that I see happen all the time is someone will put some gloves on and then they'll go touch everything, and maybe they're protecting themselves, but they're not really protecting others. So if you do want to wear gloves, put your gloves on to do one task, whatever task it is that you're wanting to protect your hands from or protect the other person from. Take the gloves off and then sanitize your hands. And I forgot to mention, sanitize your hands first, put the gloves on, do the task, take the gloves off, sanitize your hands. It's a hard thing to learn to do, and it's honestly something that we train in medicine. I mean, you also train in the food industry as well. So just be cognizant of how gloves are being used. I think that they could kind of be a false sense of security. Again, staggering appointments just to decrease the number of people that are there and standing around. But I think there's lots of ways to mitigate that and still be able to do what your typical business practice is, as long as you're cognizant of those kind of the expectations and recommendations for social distancing. A lot of this is talking about, mask wearing and, discontinuing the practice of shaking hands. That's a really hard thing to break. They're not even recommending the elbow shake anymore, just nod at someone, say hello, can't even smile with the mask on. I mean, this is definitely a hard time. So I am totally open to any recommendations on how we can better greet each other so people know that I'm happy and excited to see you. So if you have any of those recommendations, please shoot them my way. We can start something here in Indiana. Hand hygiene is important. You can't just wash your hands for 2 seconds. I teach my kids A, B, C, D, E, F, G, sing the whole alphabet, and then you'll get to that 30 seconds. And of course, before you eat, after you use the restroom, after you eat, etc. Cleaning hands between clients and making sure you have hand sanitizer around. And this is about kind of cleaning your workspace, making sure you launder in between people, which I'm sure has always occurred. Any towels or any linens that are used, including the capes, shouldn't be used from person to person. So if that means purchasing something that can be wiped down or something that's disposable, those are what the recommendations are. Again, we don't feel like it's spread on surfaces, but for the most part, but there is definitely the opportunity to. So just as much as you can do to help decrease the spread. All right, so in summary, clean and disinfect all surfaces, launder capes, towels, and linens, remove any non-essential items from your business, initiate contactless methods of scheduling and payments, wear masks, ask your clients, customers to wear masks as well, don't do handshaking or any non-essential touching, and then just make sure everybody knows about essential infection control and hand hygiene. And like I said before, please help me help Hoosiers. Everybody I talk to, I talk about these things because I think that people are more willing to act if they know the data and the information behind it. So I wanted to share that with you. And again, this is on the CDC website. So this is a case that was in Washington, and it was actually a choir practice. And again, this was kind of before everything was shut down, and one person went to choir practice symptomatic. So one person and ended up infecting 87% of the group with COVID-19. So you can just see how one person with that close contact, that mass gathering, made all of these people sick. 3 of them were hospitalized and 2 people actually died. So I've had conversations with people who have been that person who brought it on. So in this case, the person was symptomatic, and one of the cases that I've actually personally talked to the person was not symptomatic at that time, developed symptoms a couple of days later, and that person is profoundly, I mean, you can only imagine how sad and devastated you would be to know that you infected other people, especially if they had to be hospitalized and someone died. So I personally just think about that when I'm, in a group and in the community, that I would not want to put myself in that situation, nor would I want to put anybody else in that situation. Additionally, some events at some churches where there were several people who got infected by a few, including some deaths. And then family gatherings. I mean, it's summertime. This is the time for people to get together. We've been away from each other for a long time. I know that, my family is anxious to get together, and we're going to. I'm not discouraging from people to do it. I'm just saying, just be conscious of it. That they do have cases of things getting spread at a funeral and a birthday party. So just be careful and take proper precautions. And then lastly, I've been alluding to this. There's just been a couple recent studies that came out showing that have really said, hey, masks work. So there is a city in Germany called Jena, where they actually mandated masks there, and they are reporting they feel like they had a 40% decrease in their possible cases compared to other places in Germany where masks were not mandated. And did show a decrease in infection. So we do think wearing masks out in public does help protect us from each other. And so we want to continue to recommend and encourage mask use. And lastly, and this is especially important to my heart as an emergency medicine physician, we've seen a lot of people avoiding going to the emergency department because they're worried about contracting COVID-19. If you are sick, if you're having chest pain, if you're having stroke symptoms, please, please, please come to the emergency department. Please tell your friends and families. Please tell your clients and customers that we, I really worry given the level of what we're seeing in the emergency department right now. Even still, it's getting better. We're seeing more people come in, but we did see a lot of people delay care. That we take all precautions in the hospitals to make sure that you're not exposed. And we do really feel that our infection prevention mechanisms are doing a good job. And I'll also say, if it is time for you to go back to the doctor, please go back to the doctor, get your medications. Please tell your clients to do the same. We know that a lot of the kids across the state are behind on their vaccinations, so we need to get them caught up on their vaccinations or their checkups, et cetera. So I think that we are at a place where we know a little bit more about this virus, where we do feel like we can protect people and also protect the healthcare workers from the spread in those kind of situations. We need to make sure that we're taking care of our basic healthcare needs. And I think that is all that I had to share at this time, but I am definitely wanting to make sure we have plenty of time for any kind of questions that you have for me. So if you want to open it up to questions.
Great, thank you, Dr. Weaver. If you have questions, again, please use the chat function for the questions. One of the questions, Dr. Weaver, that had been shared with the commission was from our barbers, and as they reopened their business, and as you mentioned earlier, talked about going by appointment only. What about after they've serviced the patron? How much cleaning is involved? You've got a barber cape, and you've got the chair, and you've got, beard trimmings or hair trimmings, that have maybe on the floor. Could you speak to the level of cleaning and precautions that need to be taken in that situation and scenario?
Yeah, so, wipe down the cape, wipe down the chair, wipe down any cleaning surfaces or anything that the client could have touched. And I think that honestly that is the best that you can do. You just reminded me too, and another thing that we have found out is that air circulation is important. So making sure that if you leave the door open, of course it's really getting really hot outside, but just to make sure that there's good airflow as well is really important, just to make sure that the air is exchanging and not just kind of staying stagnant in there. But I think that just taking the time to wipe down anything that the customer could have touched is good, and using those typical solutions that we would normally use for cleaning.
Well, and again, and that speaks to barber capes, because most of the capes are reused. So, I would visit my barber and he would put the cape on me, and the cape is touching, my neck and my hands and things like that. So yeah, it would be very important and imperative, that that it's clean. One of the other questions that we've had is about personal protective equipment, and what businesses need to have or are mandated to have. Are there mandates from the state on, in order for a business to open, what type of PPE they have to have in order to reopen?
So for in stage 4, it is masks, and that could be any kind of face covering, but something to put over your nose and mouth. We do have a marketplace for businesses if you're looking to purchase masks. That is on the Indiana website. I don't know the exact location on the website that's at, but that is available. But I think right now it's not as difficult to find masks as it was a month or even 2 months ago. And so lots of people are selling them. Bandanas, etc. We do feel that, while the cloth masks aren't good enough for me in the emergency department when I'm taking care of a patient and I'm in the face of someone that has COVID-19 for a prolonged period of time, we do believe that it is helpful and protective for people who, are not taking care of that sick person who's coughing, etc. So it's all the things. It's mask wearing, it's spacing out, and making sure that people aren't coming in who are sick and that you're not going to work sick. I think you have to have all of those things to help protect each other.
I agree. And on the topic of mask, is there any information on how often masks should be either rotated, or if you have a cloth reusable mask, are there laundering guidelines that individuals should be concerned with?
So definitely if it's soiled, it needs to be removed and washed, right? Beyond that though, wearing a mask throughout the day is totally acceptable. I think the other important thing is, I'm actually going to demonstrate. Can they see me on the video?
Yes.
Okay. So people, make sure when you wear your mask that it goes over your nose and your mouth, and that when you go to remove it, don't grab the front, and also try not to touch the front, right? Because this is the part that would be soiled if anybody were to cough or sneeze on you. So make sure that you're actually removing it from the ears. And you'll see people put it kind of in a, the plastic boxes that you could put, leftover food in or whatever, place it in there with the ear loops hanging out, and then you can remove it from there and put it back on your face before you get the opportunity to wash it. Like if you had to eat or something or take a break, etc.
Well, that's helpful information, because I've seen individuals take their mask off by grabbing from the front, and you just alluded to the fact that they should remove them from the loops around their ears and not touch the part. But I didn't know if there was a guideline on, how often they needed to be laundered or cleaned if they're worn daily.
Right. Yep. So wash them daily, and then, but more frequently if it gets soiled.
Another question that the businesses have had, if they did not provide the state of Indiana their operating business plan, are there on the website tips that they can use to ensure that they're operating their business as safely as possible? I know, like you, I have to, before I can log into my state of Indiana system, I have to answer those questions as they relate to COVID-19. So is there a suggestion that businesses incorporate? I know many small businesses don't want to do the temperature scan, but are there 4 to 6 questions that they need to ask patrons before they come to patronize their business?
Yep. So I think the big things are, number one, have you been in contact with anybody that's had COVID-19, right? Because we know that's a high risk factor. And then do you have fever, cough, shortness of breath?
I think Dr. Weaver's screen has gotten frozen. Well, I'll just share while we wait for her screen to become unfrozen. The Commission on the Social Status of Black Males, in an effort to be proactive and educate individuals, undertook bringing Dr. Weaver to present and talk about COVID-19. I know that we're on the back on track plan from the governor, and it's being done in phases, as Dr. Weaver stated. You just didn't want to like flip the switch and one day say, okay, everything is a go and we're back in business. We wanted to do it judiciously and purposefully with a plan and a strategy. So the commission wanted to bring in a presenter, as Dr. Weaver did today, to provide information to help businesses, small businesses, to help our barbershops, to help our beauticians know the things that they need to do that can be helpful, so that they can not only provide the services to the patrons, but they can also ensure that they're looking out for the safety of their patrons and also their employees. And that's critical as we continue to move forward. Well, I don't know if Dr. Weaver was able to hop back on, but I'll share some more information regarding the Indiana Commission on the Social Status of Black Males. The commission has been in existence since the fall of 1993. The purpose of the commission is to study and take a look at Black males across the state of Indiana and how they compare with the majority population and other ethnic groups in 5 particular focus areas. Those focus areas are criminal justice, employment, health, education, and social factors. And so what the commission does is we look at statewide data on Black males in those 5 focus areas, and we prepare an annual report. In that report, we also have recommendations and suggestions. Some of them are administrative suggestions, recommendations, and some of them are legislative on ways that policies can be changed or put forth to improve the quality of life for Black males. So it's very important. And one of the things that we asked Dr. Weaver to do was to share information with small businesses that may not have access to information that larger businesses have, you know, the larger companies like Eli Lilly and some of the larger hospitals and the like. So we wanted that information to be available to those businesses to help them be successful and to get back on track. We're looking at providing additional information and resources. I know Dr. Weaver was going to provide a resource slide on websites and resources that are available, and I will ensure that we get that from Dr. Weaver and post that on the commission's website and on our social media, because information is power, and it's important for small businesses, large businesses, medium-sized businesses, all Hoosiers to have as much information as possible so that they can be as safe and as healthy as possible as we continue through this pandemic. No one knows how long this pandemic is going to continue. We're starting to get questions now as we quickly move towards the back to school period on what is school going to look like? How are school corporations going to reopen? What changes or modifications are going to occur? And as we get that information, the commission again will ensure that we provide that information on our website and through social media so that we can get the word out, because I'm sure that there are numerous parents that are maybe not worried is not the right term, but somewhat nervous about what back to school is going to look like this fall for the students. And I know that I heard recently one school corporation will be going back. I think it's either Avon or Brownsburg on July 30th. And so we're not too far. We're a little over a month and a half away from that start date. So as we get information, we will be sure to share that information with you. And we will ensure that we get those websites, CDC, the Indiana State Department of Health, the COVID-19 information, we get that out to you and make that as easily accessible as possible.
And James, I do have one question. It looks like Dr. Weaver lost connection. So we do have a question regarding, is ISDH able to identify how many Black males have died or been infected by COVID-19? And I'm going to pull up real quick on coronavirus.in.gov. You are able to break down, they do break it down into different, this is on the main page. Yes. When you go to coronavirus.in.gov, if you scroll down to the very bottom, where she was discussing the current counts on the page, if you scroll down a little further, they do break it down into demographics on the cases with the gender, age, race, and ethnicity. So those are updated daily. She did mention that they just updated these numbers this morning as well. So we will get her entire presentation uploaded onto the ICSSBM website, and we will also have this entire recorded presentation up there. And we will leave the live event up until 2 p.m. today. And if there are any questions, you guys are able to write in the Q&A box your question, and then we will send all questions on to Dr. Weaver and get you all an answer at the earliest possible time. And then James, if you want to share your contact information, that way if anyone has any questions, they can contact you directly and you can send it off to Dr. Weaver as well.
Absolutely, and I will share that. But back to the dashboard, yes, that information is available. It is broken down by ethnicity and gender, and you can sign up for that, whereby that comes to your mailbox, I think every day or every time it's updated. Or you can simply go on to www.in.gov and you can access the 2019 novel coronavirus COVID-19 information. So if you don't want to be bombarded with that email on a daily basis, you can at your leisure go and get that information. But it's very, very good information. And the State Department of Health has done a very good job on disaggregating that information as best they can to be helpful to individuals. If you have questions or other concerns for me and the commission, I may be reached at, my email address is jgarrett, GARRETT at ICSSBM.in.gov. That's jgarrett at ICSSBM.in.gov. If you'd like to reach me via phone, the number is area code 317-670-7125. 317-670-7125. And the commission's website is www.in.gov/ ICSSBM. Through social media, you can access us on Facebook at the Indiana Commission on the Social Status of Black Males on Facebook. As my colleague mentioned, we will leave this up and open until 2 p.m. in case there are additional questions or concerns. Again, submit your questions via the chat field, and we will work to get a response to your questions.
So I did go ahead and put your contact information in the Q&A box as well, so everyone can see that and copy and paste that as well.
Great, I appreciate that. And I know Dr. Weaver lost connection, and as she stated, she's in Elkhart, Indiana, Elkhart County. They are a new hotspot, but I and the commission thank Dr. Weaver for her time, her commitment, her presentation today. We apologize for any inconveniences due to her losing connection, but rest assured we will provide her presentation on our website, and we will identify those resources and websites that are helpful and ensure that we get those out and on our website so that you may access those. I thank you so much for being a part of the presentation today, and you have my contact information. If there are additional questions or concerns, please don't hesitate to reach out and contact me. I may not know the answer, but we will work and strive to get the answer to your questions or get you the information that you seek. Thank you and have a wonderful day. And again, we appreciate you participating in our live event today.